So earlier this week, actually on Monday and Tuesday, I was working with a bunch of students that were graduating from nursing school, which is very exciting. And they're going to be taking their NCLEX soon. So one of the things that we were doing was just reviewing some NCLEX questions, NCLEX style questions, I should say, and just kind of learning how to answer them. Now this question in particular kind of was a popular question because it was such a challenge. And I realized that it was really helpful that the students understood how to answer this question because the NCLEX has a lot of questions that are similar to this style, this method. And then additionally, I actually posted a question today on Instagram that kind of runs along the same lines of what question category this is. So this question, let's read it. Let's read it first. Let's start from there. So it says, a registered nurse, RN, is helping a member of the unlicensed assistive personnel, or UAP, prioritize care. Which of the following clients should the RN tell the unlicensed staff member to check first? So what you should recognize just out of the question, pulling the important meat out of the question, is we're talking about a UAP, right? An unlicensed assistive personnel. We're talking about prioritize care. So this should ring bells in your head, like most important, safety, who has to be seen first, right? And it even has a key word in here, first. So what we want to know is who should this UAP check first? The big thing you should be thinking about here, and I'm going to write it to the side, is safety, right? Safety. Who do we need to see first to ensure that the patient stays safe, that the proper care is given in the right order? Just think about who is the most important in this scenario based off of what their needs are, what their condition is, what their diagnosis is. So the first one says, a 78-year-old client with congestive heart failure scheduled for discharge. Then we have a 56-year-old client who recently diagnosed with type 2 diabetes on an oral diabetic medication. Then we have a 66-year-old client admitted the evening before with acute abdominal pain that also has moderate dementia. And then we have finally a 44-year-old client admitted the night before who is receiving IV antibiotics for a lower leg infection following a car accident. So we have 4 very different types of patients. So the first one we know is a 78-year-old. They have CHF. They're scheduled for discharge. Immediately, and I'm just going to change my color. Immediately, this should be not an option. That's not a good color. I can barely see that. Let's go with this pink. Let's just stick with the blue. So this patient should be a no. Why? They're scheduled for discharge. The very first thing in your mind should be 2 things. This patient is stable because they're going home. And this patient is going to need an RN to see them because they're going to need discharge instructions. So this has to be out of the question. Then our B option is a 56-year-old recently diagnosed with type 2 diabetes on an oral diabetic medication. Is this patient at risk for anything? Is this a safety issue? Do they have a diagnosis that's acute that we have to assess them first? No, right? Type 2 diabetes, oral diabetic medication, this is going to be out of the question. Then we have a 66-year-old client admitted the evening before with acute abdominal pain that also has moderate dementia. So what's important about this? Well, they had pain the night before, right? That's where they were admitted. And this patient has dementia. Dementia, we should be thinking definitely along the lines of safety. So they're at risk for what? They're at risk for falls. They might be at risk for other injuries, for wandering. So this is something that we would want to assign to the UAP to see first because of all the risk factors that they have. And then finally, we have a 44-year-old man client. Said it was a man, it's not a man. A 44-year-old client admitted the night before who is receiving IV antibiotics for a lower leg infection following a car accident. So we know this person has infection, they're receiving antibiotics. Otherwise, is this patient at risk for anything right now? No, right? This would be an otherwise stable patient. There's no indication that this patient has an urgent need right now that needs to be seen by the RN or that needs assistance of a UAP. So we're going to take this out of the question. So the answer is C. It's this 66-year-old with dementia. And the purpose of this type of question is that you recognize the risk potential in this question. It is all about safety. This person's a priority because they have dementia and they were diagnosed with pain. Think about those patients, our elder patients that have dementia and that have some kind of secondary issue. So pain, if they had an infection, when they're hypoxic, and how do they present? They become confused, right? And this is the critical thinking, analytical skills that we need to apply to this question. We need to recognize that this was a safety issue. So now let's look at another one here. This question is a question I posted on Instagram today. Now this question says, a client returns to the clinic 48 hours after receiving a MAN2 test. And remember, that's our PPD test, right? That's how we check for tuberculosis. The area of the induration at the injection site measures 18 millimeters. The client has not previously had a reaction to the test. Which of the following actions should the nurse do next? What do we know? We had a PPD test, which again is going to check us for a positive or negative tuberculosis. It's 18 millimeters, so we know that's a positive reaction. The clients never had a reaction that was positive prior to this test. What following actions should the nurse do next? Now, you know what we get mixed up in doing? We just naturally assume that we would do the little things and the question's looking for the big things, but that's not true. This is, again, a priority question, a safety question. Here's our safety again, safety and priority. I hope that's not too bright for you to see. So what do we do next? What do we know? Positive PPD. What do we got to do? So move the client to a negative pressure room. Well, if somebody has positive PPD, or they have tuberculosis rather, I should say, they're going to go into a negative pressure room. That's true. So I'm going to leave a check there. Have the client put on a face mask. I'm going to check that as well. We do want to have the client put on a face mask. That way we can reduce the chances that they transmit tuberculosis if that in fact is a true positive. C, prepare the client to have a chest x-ray. Whoa, that's true. We do want to have a chest x-ray because that chest x-ray comes after a positive skin test to confirm or deny if there's a presence of tuberculosis in the lungs. And then draw a sample blood to check his CBC for an elevated white blood cell count. Well, we could, but this really wouldn't be the next thing out of all these options. So I'm just going to give that one an X. So I did a little bit of process of elimination, and now I'm left with 3. So what's the priority? Thinking again, back to this safety. Let me circle this in a more pleasant color. So thinking back again to safety, what do we do next? Before we put them in that negative pressure room, before we do that chest x-ray, we need to put on a face mask. We got to put a face mask on this patient. Safety. By applying the face mask next, after we see we have this positive test, this is going to reduce the risk that this patient is going to transmit this disease, if in fact it is positive, to patients and to healthcare workers. This has to be the first action after this positive test before we move on to anything else. And so the right answer for this question is B. So I hope you found that helpful, so you see how we're answering these type of priority questions that are really focused around safety. And what I'm going to do is I'm going to do some more of these type of questions, work through them, and I'll post them so you can see that when we kind of get tied up in some of these practice questions that are a little bit confusing and maybe we're adding some information that's just not there, let's work through it together so we're all clear on how to answer it. So I hope you found that helpful.